Okay, I am doing a presentation on coronary artery disease. Coronary artery disease is a disease which affects the coronary arteries. Basically, plaque builds up in the arteries, increasing blockage of the oxygenated blood flow, and the plaque consists of fat and cholesterol that increases. So when all this plaque builds up in your arteries, everything gets narrower and constricts, so the blood flow is decreased to your heart. Other names for coronary artery disease are atherosclerosis, and this is not just coronary artery disease, it's the buildup of plaque in any artery you have. It's also called hardening of the arteries, coronary heart disease, and narrowing of the arteries. This picture here is showing two different types of arteries. The first one is a picture of an unclogged artery, and this allows the oxygenated blood to flow freely to the heart. The second picture, though, as you can see, there's plaque along the inside of the artery, which obstructs the blood flow to the extremities and the heart. So you might have problems with blood flow in your extremities and your heart. The population at risk for this disease are those who have a high level of cholesterol, hypertension, smoking, diabetes, obesity, inactivity, family history, and stress. An unhealthy diet, age, and periodontal disease is also a risk factor for this. Unhealthy diets consist of saturated fats and trans fats in food. High cholesterol and sodium is also a high risk factor. Coronary artery disease is really popular among women after the age of 55 and men after the age of 45. So it's very important to keep track of your levels of cholesterol and your sodium intake. There are two different types of cholesterol, one being LDL and one being HDL. An easy way to remember this is LDL can be kind of like the lousy type. The L can stand for lousy, and the H can stand for the high or the good, because you want a high amount or healthy. So LDL is the bad cholesterol. It's a low-density lipoprotein, and according to the Journal of Cardiac Nursing, LDL is linked with coronary heart disease for the last 2 decades, and it can form plaque, making the arteries less flexible and form deposits in the artery, making the blood flow obstructed. The other kind of cholesterol is the HDL, which is the good cholesterol. High levels protect against the heart attack, which is from the American Heart Association. HDL also carries the bad cholesterol away from the arteries back to the liver, and it can become removed from the body. So HDL is kind of a benefactor for not developing as much LDL. Salt in your heart health. High salt intake is significantly linked with a greater risk of stroke and cardiovascular disease. There is an urgent need for strategies to limit salt intake across the population. This is according to the British Journal of the Cardiac Nursing Program. Salt is really bad for you because wherever salt goes, water goes, and that increases your blood pressure when there's more water, so it's really important to kind of keep your blood pressure down as well. So maybe decreasing that extra shake of salt in your meal would be beneficial to you. Warning signs of coronary artery disease or any type of heart disease include shortness of breath, arrhythmias, which is irregularity in the heartbeat, and angina, which is also known as chest pain. It indicates complete narrowing of the arteries, and it cuts off the oxygenated blood supply to the heart muscle, leading to stroke or a heart attack. Whenever you have an indicative sign of chest pain, you need to call 911 immediately. Smoking and heart disease. Nicotine is a vasoconstrictor, meaning that it narrows your blood vessels once they're stimulated by it. In addition to the nicotine narrowing the arteries, the buildup of plaque also causes a narrower channel, leading to a decreased blood flow to the heart muscle. So when you're a smoker, in addition to eating, let's say, gravy or other types of fatty foods, it's important to decrease that so you have a less chance and risk factor for developing heart disease. Prevention. Quit smoking. It is never too late. Regular physical activity is important. Weight loss plan to control risk factors. Monitoring cholesterol levels is especially important if you're a man over the age of 45 or a woman over the age of 55. A healthy diet is always important. There should be no age indicators whether or not to start or stop having a healthy diet. It's just important to continuously have one. This includes low sodium and less saturated and trans fat. It's also important to be aware of the family history you have when you're looking at your health factors. And be willing to make a lifestyle change to decrease your risk factor of heart disease. A review of risk factors include tobacco, stress, high blood pressure, high cholesterol, physical inactivity, obesity, alcohol, and diabetes. And these are my references where I got my articles from. Any questions? I have an audience of 8. Okay, any questions?
Yeah.
How does periodontal disease affect your heart?
It affects your heart in that it's another can be an inflammatory disease, inflammation, and then that also can be a risk factor of plaque going to your heart, especially if you have diabetes. There's a risk factor right there. Any other questions?